Good afternoon. This is Dr. Christine Sauer, your host of the show Healthy Alternatives here on 97.5 CIOE FM with live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk, mostly with guests, about all aspects of health, healthcare and wellness, from conventional to alternative and everything in between. My mission for this radio show is to help change people's lives for the better by informing them about different options to get and stay healthy and well, so they can choose for themselves which option might work in their case. And if you feel you are stuck in a dark place, I want to tell you, don't give up. There is a light at the end of the tunnel for you too. Today, I'm extremely pleased to be with Ad Rassi and Uljana. Ed is not only my own massage therapist, he is also a TMJ specialist, which is a temporomandibular joint, which is your jaw joint, and a manual therapist. And Uljana is a TCM, traditional Chinese medicine therapist, and working as a licensed acupuncturist, and she's very broadly trained, and you both are working in Bedford in your practice. Wonderful. Thank you so much for coming here.
Thank you.
Thank you.
So, Ed, we had a show before, and we talked about massage and the benefits, and everybody knows it's great, except for when you do it, because you're brutal, but you do deep tissue massage, and It helps.
Absolutely.
Absolutely. So tell me a little bit about what's your favorite thing to do, and how long have you been doing it?
Well, thanks of all. First of all, thank you for having us on your radio show here. We are pleased to be a part of your show. We've been practicing massage therapy for almost 14 years. We have our clinic for almost 10 years in Bedford, and we practice massage therapy and deep tissue, and we focus on special cases from orthopedic cases to any injuries, sports injury, and any general public that they have, from shoulder problem, lower back, ankle, knees, or jaw, which is TMJ, temporomandibular joint problem.
And you're one of the few that does it here, and I know you also help with carpal tunnel syndrome and ulnar syndrome, and that's where you help me the most, because I have ulnar syndrome, which is basically carpal tunnel for the elbow. I had surgery on the right, which didn't help. On the left, then I met you, and you fixed it on the left, and we are working on the right side because the surgery makes it harder.
Absolutely. Well, with surgery, sometimes it's what they do. They get into the tendon. They clean the tendon from all the calcification that the body lay down, and the collagen fiber will turn into adhesion, and adhesion forms scar tissue and calcification. So our turn to prevent you from going to surgery when you come in. Well, thank you for you coming a regular patient of us in order to heal you and make you feel better. So what happened over the time that you become in once or twice a week for a period time of weeks, 4 to 6 weeks. So that's what help break down all the calcification around the tendon naturally, and the body will heal itself on its own. So the body, what happen, will clear those calcification that's around the tendon when we break it down. So kind of we'll give you the home remedy exercise to do hydrotherapy treatment, hot and cold and stretch, and that will help a lot. So we'll realigning all the fiber and take all the scar tissue away.
It definitely does. I mean, I'm a living proof, because my left hand is fine, and it was just as bad as the right before the surgery. Mm-hmm. And we are working on the other hand, and I'm just a little bit stoked that my neurologist and surgeon had no idea that it was worth a try. I'm not saying the surgery is in every case unnecessary, but it's worth a try before you have it done. Try deep tissue massage, try it, and maybe it resolves it, and if not, it's still time to have surgery.
Absolutely. With our healthcare system that we have here, that you wait a long time for your surgery, well, we always encourage patients to come in to try our treatment, because our treatment is very deep tissue and particularly focus on the deep tendon, because you have certain layers of muscles on top of each other. So it's very important to focus on those tendons that attach to the bone. So those one will create pulling on the nerve, create pulling on the tendon. The muscle will pull on the tendon, and that's what's calcification happens. So it's very highly recommended to have the patient who suffering from tennis elbow to golfer elbow to IT band syndrome, people have knee pain, people have shoulder pain. It's good to come in, get a try for a period of 4 to 6 weeks or 6 to 8 weeks, depending on their severity of the injury. It's a great to do that. That will help them a lot to minimize surgery, because when you go through surgery, you're not going to have your full strength back or your full range of motion back. You're going to have 80%. So that's 20% you're going to lose. So it's better to go through a treatment for a period of time while you're waiting for your surgery. If that helps, then you avoid the surgery. You don't need surgery.
And who doesn't want to do that?
A lot of people, they love to do surgery, quick fix, but they wait so long, and sometimes at the end they say, "Oh, I wish I didn't do surgery."
Yeah, I mean, it would be nice if it's a quick fix, but in some cases it doesn't even work. Like
Absolutely,
it didn't work.
Yeah, you're right. You're right. Elbow. That's what happened with your nerve treatment. You're an example. You're a great example that you have that didn't resolve a problem.
Right.
Fully.
So if I had known about it, if the neurologist in the beginning had said, try deep tissue massage first, and then I'll send you to a surgeon if it doesn't help, he might have saved the health system actually money.
Absolutely. Very important. We highly recommend here in the province of Nova Scotia that we're working on becoming legislated.
Right.
And so our health system here, and they can acknowledge us to be as a doctor or a physiotherapist or
as a
chiropractor.
Therapist, And you should, because it is definitely important. And I find together with what I do for stretches is mostly Tai Chi, which I love. And Uljana can say something about that, because you're a trained Tai Chi teacher from Israel too, like I heard.
Yes, I am. It's very nice technique to release the muscles. You have a lot of levels. It's a beginner level to try it. It's not so easy, but people who start really like it, and it's relax your mind and relax your muscles.
Yes, and it relaxes and strengthens them. And most what they call sports, Tai Chi is really not a sport, it's a practice.
It's a practice, yeah.
They only strengthen or they only stretch. It does both, which is really nice. And it's good for balance, for brain health and everything. But I find interesting that you also have a combination of traditional Chinese medicine and acupuncture. How did you get into that?
It's a long story. When I was 9 years old, I broke my spine.
Oh, wow.
And I had been 4 months in a bed, and till 16 I had pain every day, just every day, all day. And the answer that I heard from a lot of orthopedic doctors, they said we don't have nothing to do with it. Mm-hmm. And in my child mind it was why I need to feel pain all my life. Mm-hmm. I tried everything. Massage, it helped a bit, and a lot of practices. And finally I find for myself traditional Chinese medicine and acupuncture that helped me a lot. And after half year treatments, my pain is gone. And I said to myself, okay, I need to try to think about it more, to learn about it more, and finally I am traditional Chinese medicine therapist.
Wow, so now you're helping others that have chronic pain after an accident or after anything really to get rid of it.
Yeah, a lot of time people come and they say nothing helped me.
Yeah.
And I say usually you don't need to give up and try to find something for yourself. Sometimes the best way to treat your pain, it's a yoga, it's a Chinese medicine, it's a massage, it's tuina, it's tai chi.
And I love that you say that, because it's so true. Don't give up.
Never give up.
No, search for solutions. Listen to the podcast like our radio show, like this one, where I show you all the alternatives that are there, and also the conventional medicine. There's lots and lots of different options, and I personally now would say start with the natural options first, unless it's an emergency. Like when you break your arm, you want to go to the hospital.
Yeah, of course.
But if you start getting back pain and they say, oh, well, it's chronic, you'll have that the rest of your life, don't give up. Try other methods. And don't give up if the first therapist might not help you. Try another one. For me, I had to try 4 chiropractors until I found the right one. And I tried several massage therapists, and some massages feel more like somebody petting you, and that really doesn't help anything.
For me, it's very important to understand who with you have a deal. It's necessary to ask what kind of diploma you have.
Absolutely.
What kind of education your therapist have, because for myself, I have 4 years full-time, 4 years education. We learn a lot of Western medicine. I believe in middle world way. For me, it's combination of Chinese medicine that is very old and very old medicine, and combination with Western medicine. It's very important to understand what we do. If someone come with problem with spine, to know, people come and say, I have carpal tunnel syndrome, as you talked before. I have to understand what it is. And my education had anatomy, physiology, pathophysiology. It's very important. Ask what kind of diploma, what you know, and understand.
And really, I think that is a good place to end the first half of the show. Always be discriminative. Ask what background your therapist had, what experience he has, and in the second half we'll talk a little bit more about the details, who you really can help with all that, and how you exactly are doing. So this is the end of the first half, and please tune in after the commercial break for more about massage, acupuncture, traditional Chinese medicine, and so much more with Ad Rassi and Uljana Stanov. Hello and welcome back to Healthy Alternatives here on 97.5 CIOE-FM or on the web at communityradio.ca. I'm your host, Dr. Christine Sauer, and today I'm talking with Ad Rassi and Uljana Stanov here from Bedford. Now, we talked in the first half a little bit about massage therapy, traditional Chinese medicine, acupuncture, and even the jaw joints and carpal tunnel and more. That was so interesting. Now, what do you do, for example, for people, both of you really, for people with neck pain, headaches? There's so many people that have headaches, stress headaches, computer headaches.
All those... They call them headaches, and headaches that's coming from a trigger point created in the shoulder muscles. The shoulder muscle that connect the shoulder to the neck, and when those knots get activated or fired or flare up, kind of refer pain to the temporal side or the frontal head or above the eyes. So or the occipital, which is the back of the head. So people
now, how do you know that it's that kind of headache and not like run-of-the-mill headache or migraine or sinus headache?
Okay, those by testing the muscles. So when we work on the muscle and we know the muscle that's referring, when we press on those points in the muscle, they refer pain to the area that the patient come to you, tell you, okay, I have pain right here above my ear or above my eye. I have a pain in my eye or pain at the back of my head. We test those muscles that refer pain to that area, that we figure that out. Otherwise, could be something they call it the aura and non-aura headaches that's happening from some internal cranial pressure, which is internal cranial pressure on the nerve in your brain.
Yeah,
There's 12 nerves right there.
Would you agree that if in doubt, it's always good to have it checked out by your family doctor? And if he says, oh, you just have headaches, oh, it's chronic, then see somebody like Ad and Uljana.
So with those, our expertise when we do some cranial sacral therapy on that, which we will do work on the joint in the brain, in the joint, exactly where's your occiput, the back of the head, and the tailbone along the spine, so loosen up all the pressure along the vertebral column to take the pressure off the head, which is off the brain, that's referring pain to those areas.
So if your doctor says there's nothing you can do, it's not true. So what do you say, Uljana?
As I said, traditional Chinese medicine, it can help. And we have red marks to say now you have to come back to your doctor. But if people came back from a doctor and doctor said we don't have nothing to do, it's a chronic pain, a lot of people have it, we have what to do. Acupuncture treatment, they work on multiple levels. I have a lot of ways to assess you. The main assessment way in Chinese medicine, we try your pulse, and it's not like a regular understanding of pulse. We can assess a lot of things by the pulse, by to see your tongue and ask a lot of questions, and a lot of ways to help. We have 365 points in our main point in our body that can affect on your headache, whatever, immune system, nerve system, and different kind of headaches we can help in different ways. But nice of Chinese medicine that it's not only acupuncture. We can help with the herbs. We can do, if it's a muscle pain, I can work with cups, with massage. One part of Chinese medicine, it's also twinner massage. It's very common to call it acupressure massage. Yes. And we have few ways to help, not only do a needle as a people think, or to do massage, it's like come with oil to pet you, and that's it. No, it's a lot of ways to help. It's very targeted and very focused, and that leads to a good success, that you have all this education behind you. And I think it is also important that this can be used in children that are maybe afraid of needles, don't want a needle. You can do it with herbs and with pressure, with acupressure. Yeah. I like to do acupuncture for the kids because they don't afraid.
It's a mothers?
It's a most of it's a parents, But kids who come for me first time, they usually finished our treatments with nice smile. We have special, very small needles for kids. And I don't like in my first treatment to do needles. We have special small balls. It's look exactly as a needle, small needle. And I like to do it in my first treatment for kids because they understand it's not painful. Yeah. And for a second time, My own nephew and they come and say, we want an acupuncture because I have a pain. They know it's not painful.
Yeah, and it really isn't. I tried it myself, but I'm an adult, and I think you may be right. When the mother tells them, oh, you'll get needles, they think of the needles they get at the doctor's. Now, that's a big difference, isn't it?
When parents call me first time, usually I say, don't say nothing. Because when you say to your kids, don't be afraid, the first what they do, they're afraid. Because they're thinking, why they say me it? Maybe just don't say nothing. Just come and I'll explain everything for a kid by myself. I know I have been training for this and I know how to say it, and they never cry in my room.
Hey,
just don't say
good
nothing.
To know. Yeah.
We have treatment and that's it.
Yeah, you have treatment and it helps.
Yeah.
That's important. Now, when we look at the anatomy, now you both are very knowledgeable in that, obviously, because you work with it. But what is a good way to treat, like when somebody has headaches in the front part, in the side part, they grind their teeth at night? What would you think that causes?
There's a lot of factors that bring to the table when you have some bruxism, they call it, when you clench your teeth at night. It has to do something with your jaw muscles.
So you clench your teeth.
You clench your teeth. And when you clench your teeth, there's the jaw muscle attached on the joint, just in the front of your ear. And there's another one on top, on the temporal side, just above the ears, like a fan shape, big muscles. One on top and one on the bottom. One on the bottom of the jaw, one above the jaw joint. So clenching, that will create a little bit trigger point in those muscles, and that will refer pain into the head.
That can, I think, also cause ear pain.
Correct. A lot of people, they have tinnitus, right? Tinnitus, yeah.
Like a noise in the ear?
In the ear, yeah. So ringing or wheezing or any noise you can hear at night when you put your head on your pillow to sleep, you can hear those when it's quiet time. So that's happening from clenching at night, also muscle below the jaw as well, into the neck. All those factors, that the neck muscles, the front neck muscles, the jaw, and the temporal muscle, those all kind of causing factors to cause that. And sometimes you have causing factor loss of some teeth. If you have loss of your teeth in your upper molar or your lower molar, it's going to be what's happening. Your chewing is going to be changed, right? If you have loss of teeth as well, that's going to cause a little bit problems.
Well, Ed, it is really wonderful to hear about both of your wealth of knowledge, and we have to do another show about that at some point. And how can people contact you if they want to before we stop? And I think the twist is, whoever you see, check the references, check what they have for education, and how can they contact you if they're interested?
Well, people would like to contact us. They can contact us on our website. It's allsportsandwellness.ca. And either they can book online or they can give us a call or a text via 902-830-7677. And one of our team members can respond to them immediately. Or they can check us on Facebook under All Sports and Wellness as well.
Excellent. Thank you so much, Ad and Uljana. It was a pleasure to have you on the show today.
Thank you.
And please don't hesitate to contact me with any questions, thoughts, comments, or suggestions. Or if you'd like to contact Ad or Uljana, forgot the website. My email here is christine@communityradio.ca, or contact me through my website, docchristine.com. And I'm always grateful for any feedback.
Thank you.
I also want to extend a special thank you to today's producer, Luke Edinger. Thanks, Luke. You're great. You might not know this, but this is a volunteer-run, non-profit radio station. And we even have an art gallery. If you're local and you'd like to drop in, we are at 11 Glendale Avenue, Lower Sackville, Nova Scotia. Thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon on 97.5 CIOE FM Community Radio with live stream on communityradio.ca for the next episode. Goodbye and have a great day.